And so if the first responders or the firemen that show up are EMTs, they might have the equipment and the tubing, but they won't do that procedure. Yes?
Is it supposed to be vertical
The cricothyroidectomy, you're really just making a stabbing opening.
Stab down straight?
Yeah. So if they do the trach, yes, it's going to be vertical because they're actually removing a square or rectangle of several cartilages. Okay, so you're really just trying to create an opening quick enough that you can get an open, firm plastic tubing in. And you can create some airway. All right, so the first branch of each the trachea is known as a bronchus. So this first branch is a primary bronchus on each side. And it's going to have the same characteristic ring-like structure as the trachea is. All right, so if we look at this pattern here, you can see that the primary bronchi on the left and right side look identical to the trachea. If we were to look at a histology slide, what would be the best way, or what would tell you that it was trachea that you were looking at in cross-section and not a primary bronchus?
Presence of the esophagus.
Exactly right, the presence of the esophagus. Okay, so if there's no esophagus there, you can't say for sure it's not trachea. But if you do see an esophagus, then you know that it can't be the bronchus. Okay, so here we have a cross-section of the trachea. This is not two cartilage rings, it just happens to be the angle of the cut got into the tracheal ligaments, but definitely have the esophagus back here. So I'm going to diagram that out, and this is going to be the tissues that we see are characteristic of trachea and primary bronchi. So our epithelium is pseudostratified columnar epithelia. That's our standard respiratory epithelium here with goblet cells. So pseudostratified columnar. Primarily cilia and goblet cells, but you would also have microvilli. That's where you usually have those to some extent with the cilia. Then we have our cartilage, and again, this is still hyaline cartilage. Right? Many of our laryngeal cartilage will have some components are hyaline, but the epiglottic, that leaf-like one, is all elastic. So we kind of simplified it that. But we have this, let's see if I can find a darker component for that. We have the hyaline cartilage, again maintaining the open, and that's this structure right here. The one piece that does not completely enclose the ring around the trachea or the primary bronchus. And then we have smooth muscle. And this smooth muscle is given a name. We don't always name smooth muscle, but it's a very simple name. Trachealis. So there is some small constriction of the trachea and primary bronchi that can occur, but it has very little effect on airflow because our airway is so large.
It's only there in the back?
Mm-hmm. Now on the diagram, on the models, it's deceiving because they have these lines going up and down vertically, and in fact, you can see it in the microscope slide, the muscles are horizontal, closing off the space between the rings. And you can see that right here. This would be the trachealis. Right there. primary bronchi. The next set of branching are known as, not the colored ones, are known as secondary bronchi. And then we have tertiary bronchi. We even sometimes have quaternary, it's just the series of branching. I'm not going to ask you to recognize those because in a cross section you have no level idea of how many times it's branched. But I do want you to recognize whether it's a bronchus or a bronchiole. The key thing in identifying between a trachea, primary, or just our regular bronchus is our cartilage is in pieces. It's in plates which go all the way, even though they're individual, they go all the way around. So here we have the C-shaped rings in the trachea and the primary bronchus. And in secondary and tertiary we have plates of cartilage, but they completely are found in a ring around the airway. Okay? So I'm going to change my label up here from trachea and primary bronchi to secondary and tertiary. Now, when we transition from a primary bronchus to a secondary, we don't immediately change epithelia. There's a gradual transition from pseudostratified to simple columnar. But I do want you to recognize that the characteristic epithelium of our bronchi is simple columnar. Primary is going to be pseudostratified, and the early part of secondary is going to be pseudostratified, but the rest of them will be simple. So we're getting less complex, shorter and shorter.
It says cuboidal in here.
For bronchi?
Yeah, it goes from columnar from down.
Okay, at the very end, as we move into bronchioles, it's cuboidal. But the characteristic, so if you were to choose, simple columnar. So a smaller airway, I forget what color my epithelial is. And simple cuboidal epithelium. Again, we find, columnar.
Yeah, this thing is.
And that's Jack.
Yes, I have it on the brain here. Simple columnar epithelium with cilia and microvilli and goblet cells. So the characteristic epithelium is simple columnar. But again, cilia, because we're still trying to trap dust particles in the mucus made by the goblet cells.
Which one are you doing?
Secondary and tertiary bronchus. But you would also have microvilli. And we do have cartilage plates. So they are discontinuous but found all the way around. The airway.
That's the highlight.
Yes, hyaline cartilage. And our smooth muscle completely encircles the airway now.
The what? What's that? Muscle?
And we don't name it.
Oh, smooth muscle. Okay.
So it's between the cartilage and the airway. So here's a bronchus. Here's the simple columnar epithelium. Here's the smooth muscle right here. And here are the plates of cartilage. Now, we're a few months removed from when you studied connective tissue and cartilage in Bio430. So if I show you a histology like this and ask you to identify it, I will label the cartilage for you. So you don't have to sit there and wonder whether or not it has cartilage. What you need to know is that if it does have cartilage plates, it's a bronchus. If it has C-shaped cartilage rings, it's the trachea or a primary bronchus. Okay? So I will label the cartilage if it's present. Yeah, so these spaces here are lacunae with the chondrocytes. Okay? And blood vessels in the submucosa but here's the smooth muscle. Then those continue to branch, but as they do so now, they are losing the cartilage. As soon as the cartilage is absent, we now define it as a bronchiole. And again, it's a transition of epithelium. So you might find some bronchiole with simple columnar epithelia. You might find some bronchi with simple cuboidal. But if it has no cartilage, it's going to be a bronchiole. And our characteristic epithelium is simple cuboidal. Okay? Now I'm going to diagram a classic bronchiole, and then I'm going to define a terminal and respiratory bronchiole as we transition from conducting to respiratory pathways. So smaller airway, and this is going to be a cross section. Simple cuboidal epithelium. Still have cilia, but no goblet cells. We don't have goblet cells in simple cuboidal. No cartilage, but smooth muscle is present. So bronchiole, notice there's no simple squamous epithelia in this structure, so it's not going to be a gas exchange. This is kind of what I drew up on the board. All right. However, as we move farther and farther into the bronchioles, we start to see little blebs of simple squamous sacs, little alveoli. With that thin simple squamous epithelium, gas exchange can occur. But we still have a bronchiolar wall. We still have smooth muscle on the other aspects of that bronchiole. So we're in a transition component here, where we transition from a bronchiole to a gas exchange structure. It's like little grapes on a cluster of grapes. So I'm going to show you an image of this, and then I'm going to diagram it in a longitudinal section, because it's uncommon to see it in a cross section. So here would be a regular bronchiole with simple columnar epithelium and smooth muscle creating this thick wall. This is a blood vessel. Two characteristics tell you it's a blood vessel. Presence of blood cells, and what's the epithelium that lines? Simple squamous. Okay? This is a branch of the bronchiole. Notice we still have some thick walls here, but we also have thin air sacs. Gas exchange is going to be occurring here. So this is considered to be a respiratory bronchiole. And the bronchiole just proximal to the respiratory bronchiole is called a terminal bronchiole. Now, if all you saw was that, and you didn't see the rest of the slide, you wouldn't be able to call that a terminal bronchiole. You have to have the respiratory bronchiole there to identify it as such. So you would just call it a bronchiole. Okay? You have no way of knowing that in 2 microns there's an alveolus available. So let me just diagram something similar to this. Again, you can occasionally see a respiratory bronchiole in a cross section like this. You would have a break in the simple cuboidal epithelium, and in the muscle, and you would have simple squamous epithelium. That now makes this a respiratory bronchiole, because we're having gas exchange occurring there. But typically, as I indicated, we see it on a longitudinal section. So here would be simple cuboidal epithelia. In a longitudinal section, remember our smooth muscle is also going to be cut in cross section now because it's wrapping around similar to our blood vessels. So we're going to see various diameters of our smooth muscle. And then we have an alveolus forming with simple squamous epithelium. And gas exchange will be able to occur across this thin sac. But instead of having additional alveoli, we come back to simple cuboidal epithelium. And smooth muscle. That's what keeps it still identified as a bronchiole. So when we first see this alveolus, that's our transition. Okay? So at this point, this now becomes the respiratory bronchiole, and this the terminal bronchiole.
So is that an alveolus, that space right there? The sac. Yeah, there's
So there's always going to be a terminal bronchiole right next to the
Yeah.
respiratory.
But again, if all I saw was this,
It's just a bronchiole.
I just call it a bronchiole. Okay, so you have to be able to identify the respiratory to find the terminal. The other two components of the pathway that we will pick up tomorrow, then we lose the smooth muscle, and the alveolar sacs form these long hallways, like as if we were to take this room, triple it in size, and have great big rooms opening off of it. That long hallway with the rooms or alveoli opening off of it is called an alveolar duct. And then we get into individuals. So here's an alveolar duct, here's an alveolar duct. These are the individual alveoli. Right? And that's what makes up most of our gas exchange surfaces, are the individual alveoli. So we'll come back and talk about that tomorrow. One last slide. I want to go back to this early slide of the conducting and respiratory zones. And remind you of those terms, and notice where the transitions start. So the terminal bronchiole is our last structure that we associate with the conducting zone. And the respiratory bronchiole is our first structure that we associate with the respiratory zone because it has the alveolus for gas exchange. And the gas exchange doesn't occur across the bronchiolar wall. It occurs across the alveolar wall, the simple squamous component that we see with that. Okay, so we'll stop there. Tomorrow we'll pick up the alveoli and alveolar ducts. And